Hello, and thank you for your interest in participating in the webinar series that focuses on the United States Public Health Service dental careers. My name is Lieutenant Commander Shayo Adenola. I'm a public health analyst and dentist stationed at the Health Resources and Services Administration, HRSA, in the HIV/AIDS Bureau. I'll be sharing a brief overview of the U.S. Public Health Service before we begin our three-part webinar series in June. The first session is scheduled for Thursday, June 6th at 1 p.m. Eastern. We hope you can join us. Throughout the series, U.S. Public Health Service dental officers will share about their exciting, diverse, and rewarding career paths. Our focus will be on the U.S. Public Health Service dentist roles. So you'll be hearing from a panel of officers that currently serve in a clinical role, administrative role, public health role, or a combination. So a little bit of background information about the United States Public Health Service Commission Corps, and I might refer to it as USPHS during this short overview. The USPHS is one of the 7 uniformed services. The Surgeon General oversees the U.S. Public Health Service Commission Corps. The U.S. Public Health Service is a diverse team of more than 6,500 highly qualified public health professionals. Driven by a passion to serve the underserved, U.S. Public Health Service officers fill essential public health leadership and clinical service roles with the nation's federal government agencies. There are 11 professional categories, which includes dentists, physicians, pharmacists, nurses, therapists, health services, environmental health, dietitians, engineers, veterinarians, and scientists. The mission of the U.S. Public Health Service is to protect, promote, and advance the health and safety of the nation. And the core values are leadership, service, integrity, and excellence. U.S. Public Health Service dentists serve within the Department of Health and Human Services. So, for example, officers serve at the Centers for Disease Control and Prevention, CDC, the Food and Drug Administration, FDA, at the Health Resources and Services Administration, HRSA, with the Indian Health Service, IHS, and at the National Institute of Dental and Craniofacial Research, NIDCR, within the National Institute of Health. PHS officers also serve with the Department of Homeland Security, so U.S. Coast Guard and the Immigration and Customs Enforcement Health Service Corps. And finally, PHS officers serve with the Department of Justice, at the Federal Bureau of Prisons. I encourage you to visit the agency websites for more information. USPHS dentists provide clinical care and oral health education to underserved populations. Some PHS dentists are stationed with the Indian Health Service, the Federal Bureau of Prisons, Immigration Health Service Corps, and the U.S. Coast Guard. Other dentist roles are administrative. So, for example, you have dental officers or dental directors managing programs. Lastly, some officers focus on public health. We have dental officers stationed at the National Institute of Dental and Craniofacial Research, NIDCR for short, Food and Drug Administration, the Health Resources and Services Administration, or the Centers for Disease Control and Prevention, CDC. I would like to mention that U.S. Public Health Service dentists can offer disaster response as part of a multidisciplinary team. So officers deployed nationally in support of public health responses to man-made and/or natural disasters. As I mentioned earlier, USPHS is one of the 7 uniformed services. PHS officers receive the same basic pay and benefits as active duty military. So PHS officers receive 30 days paid vacation, 10 annual federal holidays, and unlimited sick days. PHS officers also generally work 40 hours a week. And again, if you are interested in applying, this slide includes the contact information for the recruiter. So 1-888-225-3302, or you can email cchelpdesk@hhs.gov for more information. So, some special benefits to consider. I'd like to highlight the long-term training and continuing education opportunities that PHS officers have. Officers can be temporarily assigned to a different agency for a specified period, and this offers the officer a potential opportunity to gain a new skill set. Officers can also attend advanced trainings or residency programs if it's sponsored by their agency. There are also dental public health residencies at the Centers for Disease Control and Prevention, so CDC, and the National Institute of Dental and Craniofacial Research, NIDCR. Some agencies offer a very robust continuing education program for free. So, for example, the Indian Health Service offers over 250 in-person, online, and webinar courses each year. Also, U.S. Public Health Service officers can qualify for the Public Service Loan Forgiveness Program since they are employed by a government agency. So this slide provides the agency contact information. I encourage you to reach out if you are interested in learning more about the agency and how U.S. Public Health Service officers are serving. Again, please be sure to tune in to the first part of our live webinar on Thursday, June 6th at 1 p.m. Eastern. I'm sure the panelists will be able to answer some of your questions. Thank you for tuning in to this U.S. Public Health Service overview presentation. We look forward to you joining our future webinars. Thank you.